So over the past 5 years in particular, there has been a dramatic increase in fentanyl overdoses, but with fentanyl comes a mixed substance called xylazine. Now, this was on the rise from 2021 to 2022, but there's been another uptick in cases over the past year. But a lot of this started back in 2020 and went to 2022, and it starts again. So what to know about xylazine, also known as Trankdo. So what to know, and I wrote down, in my opinion, some of the most important things when it comes to this street drug. So what to know, there has been a heavy increase in every state, more specifically 48 out of 50 states, very close to the DC area as well, and is easily mixed and laced with fentanyl. Now the key word, it's not used a lot on its own. It's mixed with fentanyl and even things such as methamphetamine as well. Now, first and foremost, it is a non-opioid, right here, non-opioid. Technically a sedative tranquilizer, and it's only approved for animals before surgeries, stuff like that. Also, I'm just gonna go and jump right into this. And real quick too, over the past 3 years, there has been a 900% increase in overdose deaths as it relates to being mixed with things such as fentanyl, which we're going to get into a little bit different on one specific side effect of what's causing a lot of just horrible effects from it. So first and foremost, sedation from xylazine or Trankdo, difficulty breathing, low blood pressure, hypertension in particular, low heart rate. These would be signs of an overdose from it. Right here. 5 to 8 breaths per minute in specific. Now also I'm going to go ahead, I know there's a lot going on here, but some other effects from it, what it causes in the short and long term, if you don't overdose the first time on it, dehydration, psychosis, pain, and flesh-eating bacteria, but also horrible skin ulcers, which we'll get into in a minute. Now also, with this, as I have right here, wounds. Also, severe withdrawal symptoms and risk of death. Risk of death is dramatically increased because, once again, mixed a lot of times with fentanyl right here. Now, as I stated already, mixed, it's a lot of times, it's not something taken on its own, only approved for animals, but in humans, it's very easy to be mixed with also cocaine, heroin, fentanyl, and even sometimes meth. And you might go, well, why is it mixed? Simple. It increases the effects of these drugs, in particular shooting up, snorting, or even taking it by mouth, or even looking through the literature rectally as well, as crazy as that sounds. That would probably destroy your butt. Just saying. All sorts of ulcers down there from that. Now also, another big thing, it's attractive too to dealers because it's an increase in street value and weight, but also makes whatever you're taking, it's a lot stronger, it makes it more addictive, and also and in some situations it actually can be cheaper to the person using because they're not having to go and buy it near as much from whoever their plug is or whatnot, because of it lasting a lot longer time. Also, as I said earlier, in 48 out of 50 states since 2021/2022, it's raised once again over 900%, a 900% increase in deaths alone, but also it's primarily mixed in fentanyl powder, can be sniffed, and injected. But I'm just going to go and say this, typically with this substance, it's usually injected right here. It can be swallowed as well, or even used rectally, as stated. Now, once again, with this, if you are shooting it up, that increases the effects, chance of death. Now, you can overdose any way you use this, because once again, it's typically mixed with something else, like fentanyl, A lot of polysubstance abuse going on with it. Now, as well with this, I'm just going to go ahead and say this. So the scariest thing about it is a lot of times you can't tell if it's mixed with xylazine. That's the biggest thing. You can't tell. Only thing that they have shown is it can be sometimes, every once in a while, it can be in a white, like it's mixed when it comes to things such as even fentanyl, or even if you're using fentanyl IM, if you're if you're using it the IV route, it's been said to be, it's a white brown substance. However, once again, when mixed, it can be very hard to know if it's mixed with it. So somebody who's typically using, if let's say they're using fentanyl or cocaine and the color and everything looks the same and whatnot, a lot of times it can be hidden in there to where you don't know, and then you take you use it, you could potentially overdose, or in specific with it, you use it, the effect is even better for you and you don't even know what it was mixed with, and then you do it again, has xylazine in it again, even a stronger amount of it, you overdose, somebody finds you, there's no reversal for it. There are some they think that could help, but they don't, it hasn't been shown to any effect yet. There are reversal agents for xylazine or trank dope for animals, but there have been no studies done in humans yet. There is a vasodilator that has potentially shown promise in animals, but no, not in humans. So the big takeaway as well is rise in over 200% as well in fatal opioid deaths in particular. But there has been a 900% increase when mixed with an array of different substances. But going back to this, for example, if somebody's using fentanyl, let's say they're just like, hey, I'm using my friend, let's say they throw out an example, my friend overdosed and they used fentanyl, but it's not working this time because Narcan is what helps in a fentanyl overdose. A lot of times it reverses the effects of it, can make you feel very sick. And then what somebody would use long term to stay clean would be something like Suboxone, Subutex, Methadone, etc. We've done a video on that. But there's no reversal agent for this drug. Now this is one of the most important parts I want to discuss real quick in regards to this. The reason why is what we're talking about it with no reversal agent. One of the number one side effects is stated right here. Wounds. And let me just tell you this. If you're using it and you notice you're having a lot more skin issues, pressure ulcers, a lot of itchiness from it, which causes, abrasions in the skin and whatnot, what it essentially is doing is, and this can happen in any way you're using it, what essentially is going on here is there's no tissue perfusion, meaning you're not getting enough oxygen in your blood to wherever the ulcer is. And in a lot of situations, you have no choice, but you have to go to the doctor to go get this treated. And a lot of times there's not much they can do except just routine skin care on it because there's no reversal agent. And that's the big thing right now, why they're like, there's this new zombie drug out there. It's because it's causing all sorts of abrasions all over the body that can't be treated. And I know a lot of times with people who use, for example, methamphetamine and whatnot, it looks like they're picking at their skin and whatnot. Picture that times 20, and the risk of infection goes up even more. And this isn't to scare anyone, but this isn't just a problem when it comes to, let's say you're shooting it up. This can happen in any form you're using it. And once again, what essentially is happening, well, I'm just going to go ahead and say this first. A lot of people describe it as a burning sensation that goes numb, that goes back and forth. And they look at their skin and they're like, oh my gosh, it looks like there's a legit hole in my skin that starts to spread. You can go septic. And what essentially is happening as well is xylazine it constricts your vessels. It constricts them, causing an obstruction of blood flow to extremities. So a lot of times arms, legs, it ends up in a lot of amputations and stuff. So because they can't treat it. And that's why if you do notice this, you should go seek help right away. Other things you could do, make sure, once again, washing your hands, things like this to prevent infection, because once it gets into your bloodstream, you get an infection and you have this kind of ulcer. In the medical setting, it's, you know, pressure ulcers and whatnot. You're either, a lot of times what it results in is they just have to take the limb off a lot of times with this, because it just destroys your blood supply to a lot of times your extremities, or even to your face as well. That's a big thing, which in itself can be a problem, because if you have an infection and for whatever reason you're picking at your skin in your face, getting one in your face and whatnot, getting in your bloodstream, can really affect your brain as well. Now, another thing, obviously right here, there is a higher chance, but it can happen any route, of you developing one of these ulcers which cause necrotic tissue that can lead to leg amputation and whatnot, and if you're shooting up. But once again, this can be to any way you're using it. So if you're ever considering, and a lot of times I know no one's just wanting to use this, but it's getting mixed into the fentanyl supplies, heroin supplies, even some meth, to where you just have you don't really have an option. And when you realize it, it can be too late. Once again, let me hit on this too. Also, if you are using anything like this and you think you don't have this, you know, it's not in your whatever you're using, a couple other key indicators to this, as well as obviously quit using it. But another thing is, this stuff leads to severe dehydration, which in itself, if you think about it, you're super dehydrated. Your skin becomes a lot more dry. So a lot of times when people are using these things, they're already a lot of times dehydrated, to where that's already a factor that potentially can even amplify the effects of the xylazine, using xylazine in regards to tissue perfusion and whatnot, and leading to a lot of necrotic tissue. Also, real quick, as I said, it's not approved in humans. I know I already went over this, but this is just the key stuff we need to know. It's not approved for humans. It's used primarily, it's animal species, dogs. It's an anesthetic for them. It's also sometimes considered a horse tranquilizer, but that should just tell you everything it needs. It amps up, and the whole reason why somebody would use it is it amps up the effects of whatever you're using, whatever it's mixed with. So fentanyl, methamphetamine, heroin, cocaine. So I mean, if you're snorting, there are people who snorting, cocaine can mess with your nose as it is, but you want to talk about losing your nose or half your face, like in that photo on the thumbnail, that would be as a result from somebody using that stuff laced in cocaine. Rectally, I was reading about a case as well, somebody using this stuff, and they were essentially kind of booty bumping, and essentially they got an infection down in their butt, and they were in the hospital for over 2 months, and it ended up leading to things such as kidney failure, shock. They did end up beating it, but the pain and everything that comes with that, can't even imagine it. Can't even imagine the burning and everything else going on with it. People say as well, it feels like their body's on fire. And just in general, let's say, well, what if it's not mixed and you're just using xylazine? I find that very rare for somebody to just use that alone. But one interesting thing I found with this in regards to pertaining to mental health with the tranq dope or xylazine is that it can also cause, because being a tranquilizer, it's a CNS depressant, meaning it's supposed to calm you down or whatnot, or make you sleep, or help you not even sleep, but just it's not enough. But interestingly enough, a lot of times it can lead, if you're using this, to you think you're getting good sleep, but you're not getting sleep at all. You're not getting much sleep, and you're actually in a psychotic state, which is another reason why they call it a zombie-like drug as well. Haven't slept for days, they're picking at their skin severely. You lose you're losing even, your consciousness going in and out, and that psychotic state just can't be treated. So the reason why, once again, I cover this is just reading about it. There was an increase from 2021. I mean, really around 2020 to 2022. It tapered off a little bit, but there's been a dramatic spike again. And there's a lot of times on the East Coast, but as I said, 48 out of 50 states have been reporting this in the, for example, the fentanyl supplies, the heroin supplies of it coming over into the United States. So that is your video today. Everyone, please be careful. If you're using something like this, I urge you to stop, because of what now is coming in to the United States in regards to xylazine. It only ends up in one thing: death, unfortunately, or amputation, burning, feeling like you're on fire. I mean, it's a miserable state you're in. It's miserable. A lot of times you end up in the ICU. They have to give you, but that means you essentially get incubated. I mean, an artificial airway, things like this, sepsis, which essentially, I mean, in a lot of these situations, you'll either pass or lose an arm or leg, or they'll have to do. It's like getting a severe burn. And once again, big thing to take away: there is no reversal agent for it that has been even approved in humans. And also remember, this is not a medication by itself that is approved in human form. It's only in animal form. So that is your daily dose of mental health. I have a couple other videos I'm working on. Once again, another one in regards to delirious tremens, in regards to alcohol use, but also it can be applied. It's not the same term used, but it can be applied to some other street drugs as well, in regards to hallucinations and stuff, and losing control, in regards to things such as even K2 and whatnot. But we're going to cover this. That'll be a video coming out. I've got a lot of other videos I'll be shooting out too. I know some of them are random like this, but that's how we're going to do it. We're going to have a library of lots of different street drugs used in the psych setting, hospital setting in general, and also we're going to be covering, as stated, mental health conditions. So yeah, like and subscribe, jump on board. If you want to join the channel, check out my about section. I'll put some links below. Leave a comment if you've heard about this, or just in general, if you've even seen somebody that is potentially suffered from this, or even somebody that is having a really bad like burning, or even their skin they just can't quit picking. And when I mean picking, I'm saying like it's going to the bone. If you are somebody like this, get them to a hospital ASAP. They will thank you, because it's better than if you just don't at all. Leave a comment. That is your daily dose of mental health. Like and subscribe. I love you all. Have a great weekend.